Hello, I'm Mr. Wigginton. I'm the Director of Learning for PE here at Chobham. I firstly want to thank you for choosing Chobham as the place that you want to continue your studies, in addition to choosing A-level in PE. It's a great choice, it's a fantastic course, and you're going to learn lots and lots. I'm now going to pass you on to Miss Ellis, who is the Coordinator of Academic PE, and she oversees the A-level, in addition to teaching in Year 12s and 13.
Hello, if you are watching this, then hopefully you are one of our future A-level PE students. My name is Miss Ellis and I lead on GCSE PE and A-level PE courses at Chobham Academy. What this video is hopefully going to do is give you a bit of an overview on the A-level PE course and everything you can expect if you were to study it at Chobham Academy. We follow the AQA exam board, so if you want more information on the specification, you can use their website. There's also 3 different sections which I'm going to explain today: the theory element, the practical and the coursework elements. The first thing I'd like to go over is the course content. So as you can see here, there's 7 different bullet points and these are the different topics that you will study. The theory is worth 70% of your overall final A-level PE grade, and that is split into 2 exam papers which are worth 35% each. All of this content is taught in lesson time, and then there is also an expectation that you would, after the lesson, go away and complete some independent work, some extra revision, some extra reading to support what you've learnt in class. Here is the content overview in a little bit more detail. So as you can see, it's split into the 7 sections, and the black text is everything that you're going to cover in the first year of studying A-level, and then the blue text is everything that you cover in your second year of A-level. What you're probably thinking is you're familiar with lots of these words already. Everything in red is something you've probably covered at GCSE PE if you was on the AQA exam board. Edexcel, OCR also follow very similar, so you also might be aware of lots of these topics. We will study them in greater depth, so you will learn some new things around those topics. And then all of the writing in black is things that you probably don't really know much about at the moment, and we expect everyone to be in a similar sort of position. In terms of practical, this is worth 15% of your final mark. We don't have practical sport lessons as such because everyone does lots of different sports. Therefore, you must be training and competing in one sport outside of lessons regularly, whether this is being a part of the football academy, whether this is you playing basketball for a local team, and you must be able to get video footage of a competitive game or a competitive performance for whichever sport it is that you are taking part in. If you're thinking, that's definitely not me, I don't play sport or I don't have a sport, then it's worth getting in touch with me as soon as possible to discuss what your options might be. Coursework. Now this is usually not a favourite aspect of the course, however it is worth 15% of your final grade. You also have a lot of autonomy in how well you do in this because you can spend a lot of time completing this and improving it to get it up to a nice high standard. Now this is an analysis and an evaluation of one sporting performance, so you can do this based on your own performance and then you do a lot of comparisons to elite athletes. It's more detailed than it is at GCSE PE, and we do teach a lot of it in class and give you some time in class to complete it, but the majority of it is completed independently in your own time. Now, as part of your transition materials, you have got a task in there where you can start a part of your coursework now. That will be really, really beneficial for you when you then have to start completing it and submitting aspects of it when you start the course. These are the books that we use for A-level PE. So this one is all of the content that we'll cover in year 1, and this one is all of the content that we'll cover in year 2. Now, you don't have to buy these books because we do have them at school. However, if you would like something to use at home as part of your revision to help support you with your independent work and learning the content, then you can get these as online ebooks, which is quite a good idea because then you can access them on your phone wherever you are. You can access them on the computer. It's really good for going over lots of the content, but it's worth remembering this doesn't provide the evaluation and analysis that you need to get A's and A stars. So it's really good for content, but doesn't provide evaluation analysis. That's the sort of thing that we practice and wider reading will give you. I've mentioned wider reading a couple of times now, and what this does is gives you different people's perspectives, viewpoints. You've got scientists breaking down and giving their own analyses. So this basically gives you lots of different ideas of different things you can watch: films, books, video clips, series, and watching these will help with your analysis and evaluation when it comes to writing long answer questions and also just analysing performance and things like that. So have a little look at some of these videos and series and things, and just enjoy them really. Now, I hope that gives you a really good overview about everything that you can expect if you were to study A-level PE, and a few things that you can now go away and be getting on with. If you want any more information at all, please do get in touch with us. And as I've said before, if you want to see the specification in more detail and everything that you'll be learning, then go on the AQA website and look for the A-level PE specification, and you'll find lots of information in there. Hello A-level PE students, we are looking at types of injuries today, specifically acute injuries, which as you'll see by this definition here is a sudden injury. A chronic injury is different, that is something that occurs over a long period of time. Acute injury is something that happens suddenly, it's caused by an immediate event such as someone tackling you or a really sharp twist, and usually you feel that sharp pain immediately. Starting with fractures. So anytime there is a break or a crack in the bone, it's actually a fracture. There are many different types of ways that a bone can fracture, and we're going to learn about those different names in a moment. But for now, you need to know that fractures are split into two different groups. You've got a simple or a closed fracture, which is where the bone stays within the arm, for example, if we was looking at the arm, doesn't penetrate through the skin or the tissues at all. If you was looking at a compound or open fracture, the bone will penetrate through the skin and you'll be able to see it sticking out. So there's two different types. Why then is a compound or open fracture going to be more serious? This is because there is a higher risk of infection. There might be lots of germs on your skin, or you might get some dirt inside the cut, and then there's going to be a greater risk of infection. There are 6 different types of fracture. What I'd like you to do is pause this video, research the 6 types of fracture. You can use Google to do this, draw them out and describe them, and if you can find out how they might occur, also make a note of how they might occur in your sport. You're going to need this information for a quick quiz that I've got coming up next. You should know now exactly what those 6 different types of fractures are and be able to identify them. So you've got some pictures here. Your job is to write down in order of left to right what types of fracture each picture is showing. Once you've done that, then you can unpause this video. Are you ready to find out the answers? The first one is green stick. Second one is buckle. However, if you put green stick, I can understand that because I can see how this protrudes inwards a little bit. So if you've got green stick, don't be disheartened for that one. Comminuted, hairline, again, green stick arguably, however, it is very, very fine line, so it is a hairline. Longitudinal, compound, and our final one here is buckle. And again, same thing, see if you can write it down in order of left to right, the correct type of fracture for these 5 different pictures. Pause this video, unpause when you are ready. Okay, here we go. Green stick, comminuted, spiral and spiral. If you wrote in there as well, open and closed, then that can be a bonus point for you. I do apologise if you've got a bit of a weak stomach here. However, here are some pictures of some fractures and you'll be able to notice some different things about them. So I'm just going to put up here some signs and symptoms of different fractures, and you'll be able to identify which of the pictures show these different signs and symptoms. You might even be able to recognise some of the different signs and symptoms or pictures with your own injuries that you might have had in the past or injuries of friends or teammates. And Now, dislocations are an extremely unpleasant immediate injury that happens. It's very, very painful, and it's when the ends of the bones are forced out of the position. As you can see, this bone here should be sitting in this bone here. However, it has completely left, so it's forced out of its usual position. In sport, it often occurs when a player might fall over or they might contact another player. Can you think of an example where a dislocation would be likely to occur? You might have even seen this happen on TV or hopefully not, but in real life. So the examples that I come up with in football and rugby tackles, sometimes the tackles are quite hard, and other players might go in too powerfully or too aggressively and force someone's leg to go one way while their body is falling the other way, and the dislocation might occur. Other examples, common dislocations, are in falls in skiing, and when you have sudden changes of direction, maybe in netball, when you're changing direction really quickly, your body weight forces you to go one way, but actually your foot might get stuck in another position, and then you could dislocate your knee, for example. They're often really easy to see simply because you can see that the bone's visibly out of place. Strains, not to be confused with sprains, which we'll look at separately afterwards. Strains are muscles and tendons. So if you can look at these diagrams on the right hand side, here is the muscle here, and then here is the tendon underneath, attaching to the bone. It's actually between the muscle and tendon where it happens. It can happen in grades. So you can see here, you've got a grade 1, you've got grade 2, and then you've got a grade 3, which is a complete tear. That obviously shows the severity of the strain. They usually occur due to some sort of contact when the muscle is really overstretched. Can also occur when the performer is continually accelerating or decelerating, and elite athletes often have them due to the intensity and overuse or intensity of their training and overuse of certain muscle groups, which can then cause them prone to muscle strains. What I want you to think about is, how does a warm-up prevent a strain? A warm-up will increase the body temperature and increase the muscle temperature, and the higher the temperature of the muscle, the more elastic the muscle is, the more it can stretch, and then there's less chance of it overstretching and tearing because it's nice and warm and nice and stretchy. Sprain is the one that it often gets confused with. Sprains occur to ligaments. If you don't know what a ligament is, it's a tissue that joins bone to bone. So it will link together two bones and hold them in place. Now, in sport, we obviously have lots of twisting and turning to get away from our opponents. And if you have some sort of excessive force that's applied to a joint, similar to what we said about a strain, about how it occurs, but the ligament becomes stretched too far and tears. So it's not the muscle that becomes stretched, it's the ligament. And you can see here again that it's got a grade 1, a grade 2, and a grade 3. And a grade 3 is a complete tear of the ligament. The picture down at the bottom here, you'll see that you've got the ligaments of the knee joint, and you can see here that it's been torn from the outside. That looks to me like a grade 2 strain. It's more than a grade 1, but it's not a complete tear. And this image on the right hand side here, you can see that it is a complete tear there in comparison to the grade 2 on the other side. You can also see the ligaments that are joining in the middle between two bones. So again, they can tear. So you can have the ones on the outside, you can have the ones in the middle. You can even have ones that cross over like this, and they can also tear. Really, really common injuries to happen, especially in football. You might hear people say, "Oh, I've torn my ACL," and that is your anterior cruciate ligament. You can see just in the bottom there. To complete this lesson, you've got 6 tasks to do. Number 3 should be already done from earlier on, and the rest of them you can either use different aspects of this video. You might also need to use the web to be able to complete some further research to answer these questions fully in as much detail as you can.